Hi, I'm Dr. Lori Byron, and I'm doing the Climate and Health Advocacy Lecture for the Climate Change and Human Health in Montana training series, sponsored by the University of Montana, the Montana Public Health Training Center, and the Montana Health Professionals for a Healthy Climate. My talk will be divided into two talks that are about 20 to 25 minutes long. The first one's 25 minutes long. So I will share my screen. So first, I'd like to explain why I'm here talking to you. Rob, whom you heard from in an earlier lecture, and I worked in the Crow Agency Indian Health Service Hospital for over 2 decades. We raised our 2 girls in Montana. Even though we saw patients in the exam room like regular doctors, we did public health. We looked at problem areas, be it car wrecks or diabetes or high rate of a particular infectious disease, or how to prevent and address the conditions. But climate change wasn't really on our radar until the last decade. We had one of those oh crud moments when we started looking at the data and all the health problems that climate change was causing. We realized that unless climate change was addressed, many of the gains from public health efforts in the last century could be lost. And that's when we started getting involved in climate change work. We eventually both retired from Indian Health Service and started doing part-time doctoring and full-time climate advocacy. We've been in Hardin, Montana for 33 years. We're members of the Montana Environmental Information Center and Northern Plains and Sierra Club and Climate Smart Montana. But more importantly, we co-founded and co-chair the Montana Health Professionals for a Healthy Climate, which has been going for about 2 years. I also head up the Climate Change Committee with the Montana chapter of the American Academy of Pediatrics. I'm a pediatrician and also have a program of climate advocates within the Academy of Pediatrics that I'll talk about later. So the learning objectives for this lecture is to explain the power of healthcare provider advocacy, both in coalitions and with politicians, identify an action applicable to your place of work or your community that can be accomplished without additional staffing or funding relative to climate adaptation, or identify 3 potential partners in your community with whom to ally to increase the value of your efforts. So first of all, why do we do this climate advocacy? Well, on the selfish side, it actually makes us feel better. It's been research proven by our psychologist colleagues that when we work at something that we're concerned about, we feel better. Even if we lose particular battles, we still feel better. It's also a great treatment for solastalgia. Solastalgia is the feeling that you've lost your home when you're still living in your home, a sort of existential loss that people started using in relation to the environment and climate change. So what is advocacy? The act of pleading or arguing in favor of something, such as a cause or an idea or a policy, active support. And why does advocacy matter? Well, The Lancet's one of the oldest and most highly esteemed medical journals in the world. The editors created the Lancet Commission on Health and Climate Change about 25 years ago. They've been tracking what countries are doing related to their commitments, especially under the Paris Agreement around the world. The commission noted in 2015 that climate change is the greatest global health threat facing the world in the 21st century. And they turned around and said tackling climate change could be the greatest global health opportunity of the 21st century. So we'll talk about these 2 disparate facts later in the talk. So why does advocacy matter? Well, do any of these conditions matter to you or affect you or your family or your patients? It's hard to imagine that at least one of these doesn't affect you, your family, or your patients. As health providers, we advocate for our patients all the time. We intervene in schools for children with learning difficulty. We send a letter to the power company when a patient didn't pay their bill and has life-saving electrically run medical equipment in the home. We advocate to legislature when we care for deaf patients and legislations proposed that could make life harder for them. We try to find an affordable medicine for a patient's condition. Climate change and air pollution affects all these conditions on this slide, and we should advocate because of them. Fortunately, human health has become the new face of climate change. Human health is more applicable to more people. I personally love polar bears, but not everyone does. And on top of that, Health providers are among the most trusted voices in the American public. For the last 18 years, the Gallup polls has run a poll on who people trust, what profession in the United States. Every year, the nurses have won. Doctors, dentists, and pharmacists are a little bit behind them, but they're still in the top 10. So some of us might feel a little different after COVID, but we are still really trusted voices in America. If you start noticing now, even the environmental organizations use human health as one of their reasons to further their cause. Just looking recently on the internet, I saw on the World Wildlife Federation, there was an article, The Human Health and Climate Connection. On the Natural Resource Defense Council, there was an article, The Health Impacts of Climate Change. On the Sierra Club site, there was 5 global health solutions in changing climate. And I might add that Sierra Club has been working with health providers and faith communities for many years. And the Trust for Public Lands, they actually have their own in-house public health person that researches and finds research on the benefits of green spaces and increased public lands and green playgrounds on human health. And these conditions also affect climate change. So I hope that I've convinced you that it's appropriate for healthcare providers and others who care about human health to advocate for their patients. I see several ways that we can do this, and I hope that one or more of these might appeal to you and apply to you. I'd love to hear from you if you have other ideas. So as healthcare providers, we can advocate in many ways on climate change. This is a busy slide, but we're going to take it piece by piece. And the section that we're going to talk about today is the first section, looking at your Montana chapter of your professional society, the national professional societies, and hospitals and clinics. So the first one was the Montana chapter of your professional society. There are several things that we can do within our societies. And these are just a few of the examples, and we will explain them a little more in depth. I apologize here. You can do a climate resolution. This has been done by the Academy of Pediatrics and the American College of Physicians in Montana. We can create a climate committee. We can add climate to the legislative blueprint, to the e-newsletters, or to the website. Our organization can ally with the Montana Health Professionals for Healthy Climate, and we can offer CME at our annual meetings. So taking these one by one, both the Montana chapter of ACP and the Montana chapter of the AAP did climate resolutions in the last few years. They're fairly easily, and we have templates if anyone is interested. They're important for a couple reasons. One, it puts climate on the map for your specialty in Montana. Some of your professional colleagues do not understand that climate change is affecting human health or the depth of how much it's affecting us. Even though most of our national societies have had some statements for years, it's likely that your Montana chapter probably does not. And number two, it often opens the door to some of the other actions within your Montana professional society, like being allowed to write an article in your society's e-newsletter. I might also add that neither Montana AAP nor Montana ACP was in the habit of adopting resolutions. Neither had ever done so, but this topic was important. And they agreed to do it when it was requested by some of their members. But also, perhaps more importantly, is what a resolution does to our elected officials. If we think about our Congresspeople want to hear from their constituents. They want to see that the issue at hand, which is climate in this case, matters in their state, sorry. As we have seen in the past few years, some Congresspeople do not care what the National Academy of Sciences or the American Nursing Association or the American Medical Association says about climate change. Because in fact, every single major medical body in the world and every major scientific body in the world that do any kind of advocacy have all publicly said that climate change is happening, it's human caused, it's affecting our health now, and it demands urgent action. But these same Congresspeople do care what their constituents say. So when 200 Montana sanitarians, for example, say that they care about climate change because they adopted a resolution, that matters to our Congresspeople more than all these big, huge national and international scientific and medical bodies. Additionally, most of us have small organizations here in Montana, and we're lucky if we have a part-time executive director. we don't have a lot of resources for legislative advocacy. So having a resolution actually allows other groups to use our concern about climate as they lobby. So they can say in Congress, even the pediatricians in Montana care about this problem. They say that we want to see urgent action on climate change. So that has power too. And you can start a climate committee. There's more action when there's more people. I have to admit, in Montana AAP, I wasn't planning on doing so because I wasn't sure that anyone else would be concerned enough that they'd want to join a committee. But the first time I asked, I actually got 4 immediate replies of yes, and we formed a committee. And of course, you can do more in a committee. So for example, in AAP, we just recently applied and got a grant to expand the EPA air quality flag program in Montana. And what happens with the flag program is when a school adopts it, they look at the air quality for the day, and then a selected child or classroom gets to hang the proper flag for the day. And this is a way to sort of reach out into rural communities and remote communities, some of which don't really accept climate change, and at least start getting our foot in the door that air quality is affecting our health. And scattered through this talk, this lecture and the second one on the same topic, there'll be a climate action that you can take here and there. So here's a climate action for you. We really need the names of someone in schools to be able to contact about this problem. If we just contact all the front desks of the schools in Montana, we're not going to get many replies. But if you know the name of a science teacher or a school nurse or another school employee, just someone that gets things done within a school that you've worked with or that your children have been in, that would really be helpful. And you can send that name right now to me at lori.byron@gmail.com. That would be really helpful. You can also form a legislative blueprint. A blueprint is a written plan defining and prioritizing the issues to help a group in developing a legislative strategy. We have one in Montana. That's the little colored cover on the right-hand side of your screen. And this is what we added about climate change in 2020. Now, some people aren't quite this formal on what they do with legislature. It might be different in different groups. And you might find that your group might agree to lobby on certain issues that relate to climate and not others. For example, the nutritionist might decide to work on issues that affect food and climate, like sustainable farming and supporting local agriculture, and not lobby on things like energy issues. I think that this past year, the Montana Academy of Pediatrics and the Montana Health Professionals for Healthy Climate provided the first health-related testimony on climate and energy issues in the Montana legislature. And this is important because the same people that don't necessarily like to listen to what the international scientific bodies say, they also sometimes don't like what the environmental groups have to say. So as healthcare providers, we can lend a different voice. And it's hard for them to argue with us when we're talking about health effects. In addition, we can put things on our websites and our e-newsletters, and that happens easier if you already have a climate resolution or you've already talked about climate with some of the leadership in your organization. So for example, with the Academy of Pediatrics, I didn't want to overwhelm them, but we just put 3 links on our website. It's there. It's forward facing, so you can see it without a password. So if parents come to our website to look for resources, they can see this also. So it lets both our parents know and our AAP members know that climate matters to us. And most of the e-newsletters that the executive directors put out, they're pretty open to letting us put short articles in them. You can also become an ally with the Montana Health Professionals for a Healthy Climate. So our allies are local medical organizations that support our principles and share our concerns about climate and health. Right now, the Montana Public Health Association, the Montana chapter of the American Academy of Pediatrics, the Montana chapter of the American College of Physicians, and the American Lung are our allies. So we would love to have your allies, your organization become an ally with us too. Many of these groups, again, like we talked about before, might not have the time or the manpower to lobby on climate issues. But as we get more groups to ally with us and we lobby or educate our legislatures, having allies gives us more strength and more credibility. So you can also suggest that they offer CME at your annual meeting on climate and health, and we can certainly help you find great speakers both within the state or nationally, depending on what your specialty is. In Montana to date, as far as I know, the Montana Medical Association had a talk on climate change at one of their evening dinners a couple of years ago. The American Colleges of Physicians has had a CME on this twice. AAP has had at least one CME and one evening session. Montana Public Health Association and the Montana Environmental Health Association, which usually have their meetings together, they have both had talks and will have another talk this year. Big Sky Pulmonary has had a talk in the past and will again in 2022. And the MedStart program, which is the summer program for high school students that are going into health fields, had a training on climate change and health this summer. And then this year, the Montana Primary Care Association and the Montana Hospital Association are having their meeting together, and they have accepted a proposal for a talk on climate change. So it is happening. So you can also work within your national professional society. These are some examples of national societies that have a commitment to climate change. The Environmental Health Organization, the Public Health People, American Nursing, not MMA, the AMA, the American Medical Association, the pediatricians and the College of Physicians, which is the internists, the obstetricians and the family practitioners. And there might be more. Some organizations also have official climate sections within them. I know for sure that APHA and AAP does. I don't know if others have similar divisions, but it's worth checking on. And we'll talk in a moment about the societies that don't really have such subdivisions and what we could do in that case. The Medical Society Consortium on Climate and Health was begun in 2016. It's mostly physician-based, but they now represent, the organizations that are umbrellaed under them now represent about 60% of all the doctors in the United States, or about 600,000 doctors. So again, when they go to Congress, they have a lot of power because all these people are behind their name. They advocate for climate action with the power of all these groups. And these are their members, and there's also about 70 affiliates. So for example, the Montana Health Professionals for a Healthy Climate is one of their affiliates. For a number of these, it's been a single individual in that organization suggesting it to the leadership that got them to join the Medical Society Consortium. And it's free. So if your society isn't on here, let's think about it. In the AAP, I was fortunate enough about a year and a half ago to start a program. And my thought was that AAP proclaimed climate change as a concern. We had staffers that worked on energy and climate issues, but there were relatively few of our 67,000 pediatricians that were really involved in any AAP climate action. And hardly any state action was occurring by pediatricians with the power of the AAP behind their name. So we started the AAP Chapter Climate Advocate Program, and we now have 1 to 5 climate advocates in all of our chapters. And we meet every month and we motivate each other to take climate actions, to do some of the kinds of things we've just talked about, like getting a resolution or a committee or getting information in the newsletter or on the website or having CME, and a number of novel ideas, some of which we'll discuss later. And we've actually had a pretty impressive success rate during that time. Before we started, there was only 1 resolution, and that was in Montana, and there's now 15 states that have them. There was 1 climate change committee, and we now have 17, so about a third of our chapters. And we've gotten information on climate into a number of the websites and e-newsletters, and 3 states have had environmental health and climate change in their annual meeting. So the American Nurses Association hasn't been super active on climate. They do have a resolution or a policy on it, but the ANNE, the Alliance of Nurses for a Healthy Environment, has been really active on climate, especially in these past few years. Climate change has been one of their major emphases. They started the Nurses Climate Challenge a few years back. It's still going, and you can sign up. And they recently started the School of Nursing Commitment. Montana State University has actually signed up for this, which is really exciting. They also offer internships, and we've had 1 Montana nurse that did one of their internships under Dr. Beth Schenk, who is a Montana Health Professionals board member. She's a nurse, and she's also the sustainability coordinator at St. Pat's in Missoula. The RX for Climate group is an international group that was just started recently, last month, in fact, and Dr. Haley Blackburn from the School of Pharmacy is one of the organizers of this new international group. There's been considerable action within the American Psychiatric and Psychologic Association, but the psychiatrists still started the CSA, or the Climate Psychiatry Alliance, a couple of years ago to get more action on climate and more raise the flag more on mental health problems related to climate change. The AAFP didn't really have specialty areas, but concerned family practitioners started the Climate Change and Environmental Health Member Interest Group. A group of retired oncologists started an oncology climate group. A radiology resident at Wake Forest University started a climate radiology group just this year. And among the dermatologists, the Climate and Environmental Affairs Expert Resource Group was started last year. And then the medical students started the Medical Students for a Sustainable Future about 2 years ago. They now have students in about 30 different states, and they've been very active politically. So the other way we can act professionally is within the hospitals and clinics. So Healthcare Without Harm is an international organization. They actually have 17,000 hospital members. Green Health is the US version of US part of Healthcare Without Harm. The US healthcare system actually contributes about 10% of our carbon emissions, so it's pretty significant. So what Healthcare Without Harm and Practice Green Health do with hospitals is help them focus on food systems, on their energy sources, operating room waste, anesthesia gases, and energy efficiency. And they've actually found that these topics save the hospital money, as well as decreasing the carbon footprint. There was one doctor in Portland, Oregon, just a couple of years ago that saved his hospital $1 million in the first year that they started addressing these problems. Providence Hospital, that's in throughout the Pacific Northwest, and the one hospital in Montana that's under Providence is St. Pat's in Missoula. They have actually made the strongest climate commitment to date just within this past year. Seattle Children's Hospital last year during COVID committed to 100% renewable energy by 2025, which was a huge step. Some of you might know, but desflurane is a common anesthesia gas. It's 2,500 times as potent as carbon dioxide. And in most places, it's just vented right into the atmosphere. They actually can be trapped and they can be recycled. And anesthesia gases are actually quite expensive, but most facilities do not do this. And then there's a clinic version of this, and it's called mygreendoctor.org. And this was started by one doctor who was a member of the American Medical Association. My Green Doctor is something that any sort of health facility, outpatient health facility, can adopt. And the way it's set up, it requires a 5-minute meeting every month by a couple key people within your office. And they send information to you. It's all kind of laid out for you. It's really helpful, and it's been shown to create real reductions in your carbon footprint or your greenhouse gas emissions from your clinics when this kind of program is instituted. So that's all we're going to talk about today. We've talked about this, the first 3 topics under number 1 here, and we will come back with a second lecture. If you want any information on anything that I've given you, please contact me. And if you have any contacts for within schools that might consider adopting the FLAG program for their school, be it elementary or middle school or high school, or even Head Starts and early intervention programs, please email me. Thank you very much.